Hello demystifiers, welcome to Medicine Made Easy with Skills, where we demystify the complexities in medicine. In today's video, we'll be seeing an overview of acute inflammation, the body's first line of defense. Have you ever wondered why your skin turns red and swells when you get a cut or an infection? That's acute inflammation at work. It's your body's first line of defense against injury and infection. Without inflammation, infections will go unchecked, wounds will never heal, and injured tissues might remain permanent. In this video, we'll break down what acute inflammation is, how it works, and why it is both helpful and sometimes harmful. Let's dive in. Here's our outline. So we'll be looking at the introduction to inflammation and definition of acute inflammation, causes of acute inflammation, cardinal signs of acute inflammation, how acute inflammation works, chemical mediators of acute inflammation, general features of inflammation, clinical examples of acute inflammation, outcomes of acute inflammation, treatment of acute inflammation, and finally we'll take a look at a case scenario. Generally, inflammation is a response of vascularized tissues to infection and damaged tissues that brings cells and molecules of host defense from circulation to the site where they are needed in order to eliminate the offending agents. It is classified as localized or systemic and acute or chronic, but our emphasis for today's video is acute inflammation. Now, what is acute inflammation? Acute inflammation is the body's immediate and early response to injury, infection, or harmful stimuli. It is a protective process designed to eliminate the cause of injury, remove damaged cells, and initiate tissue repair. This process is mediated by immune cells, blood vessels, and chemical signals that work together to restore normal function. If not properly regulated, inflammation can contribute to chronic diseases. The common causes of inflammation includes infections from bacterial, viruses, fungi, and parasites. Then we also have physical injuries from cuts, burns, sprains, fractures, and blunt trauma. Then we have chemical irritant from toxins, acids, and alkalis. Then we have foreign substances like splinters, dirt, or allergens. Then we also have immune reactions, that's allergies and autoimmune responses. For a better understanding of the concept of inflammation, let's take this analogy. See the human body as a company with several staff. Then suddenly, some vagabond found themselves in the company. They had a warm welcome, but not long they became rebellious, and this angered the chief security officer, which led to a conflict. Now the CEO, in an attempt to resolve the conflict, will cause a degree of discomfort and tension in the company. The act of conflict resolution in this analogy is synonymous to inflammation, while the discomfort and tension that rises during the period of conflict resolution is synonymous to the cardinal signs of inflammation. Now this brings us to the next outline, which is the cardinal signs of inflammation. A Roman medical writer, Aulus Celsus, documented the first 4 classic signs of inflammation, which include redness, swelling, pain, and heat, in his medical text, De Medicina, in the 30th BC. Now later on in the 19th century, a German pathologist known as Rudolf Virchow added the 5th and last cardinal sign of inflammation, which is functional laser. Now let's discuss these 5 cardinal signs in details. First, we have redness, in Latin rubor. This is as a result of vasodilation, which allows more blood flow to the area. Of course, energy is needed for the conflict to be resolved, and this energy is transported by blood, hence the increased blood flow to the area affected. Then second, we have heat or warmth, known as calor. Now this is as a result of increased metabolic activity in the area. Then the third cardinal sign is swelling, known as tumor. So fluid leaks into tissue spaces, causing swelling in the area. Then the fourth cardinal sign is pain, known as dolor. Now nerve endings are stimulated, which causes pain in the area. Now, the last cardinal sign of inflammation, as described by Vico in the 19th century, is loss of function, which is also known as functional laser, right? So movement is restricted to allow healing, right? We see that sometimes in conflict management, we suffer state of emergency, curfew, or even lockdown, where the normal function of the entity is deprived. All this is towards seeing that the normal function of the body or the entity is restored. Wait a minute. If you've ever had a swollen ankle or a sore throat, then you've experienced these cardinal signs firsthand. How does acute inflammation work? The process of acute inflammation is divided into two stages. The first is vascular changes, and the second is cellular response. Vascular changes include vasodilation. Now, vasodilation leads to increased blood flow, which causes redness and heat, increased permeability. Now, plasma leads to tissues causing swelling, that's edema. Then endothelial activation. Here we see that white blood cells migrate to the injury site. Then we have the cellular response. Now, in cellular response, first we see that neutrophils engulf bacteria and debris in the process called phagocytosis. And secondly, we see macrophages and monocytes clearing debris and release more inflammatory signals for tissue repair. Mast cells and basophils release histamine causing swelling. Then we have platelets. What does platelet do? Platelet help with clotting and tissue repair. Chemical mediators of inflammation include histamines, which causes swelling and redness, prostaglandins, which increases pain and fever, then cytokines like interleukin-1 and tumor necrosis factor alpha, which attract more immune cells. Then we have complement proteins, which enhance immune responses. These chemical messengers coordinate the entire process to ensure the body heals properly. General features of inflammation include 1. Recognition. So cellular receptors that recognize microbial products and other harmful substances recognizes the initiating stimulus for inflammation and release substances, leading to the production of mediators of inflammation that trigger subsequent steps of the inflammatory response. Now, in this way, the offending agent, which is located in extravascular tissues, is recognized by host cells and molecules. The second R stands for recruitment. So leukocyte and plasma proteins are recruited from the circulation to the tissue site where the offending agent is located. The third R stands for removal. Now, removal of stimulus for inflammation, mostly by phagocytic cells that ingest and destroy microbes and dead cells. First, the leukocyte and proteins are activated and work together to destroy and eliminate the offending substances. And the fourth R stands for regulation. Now, the whole process of inflammatory response is regulated to terminate the reaction when the objective is achieved. Thereby, the inflammatory reaction is controlled. Now, the fifth and last R stands for repair. Now, damaged tissues are healed by regeneration and or replacement by connective tissue. Then clinical examples of acute inflammation include bacterial infections like pneumonia and tonsillitis, physical injury like sprains, burns, and fractures, allergic reactions like asthma and anaphylaxis, autoimmune diseases, which includes acute flare-ups of lupus or rheumatoid arthritis. Then what are the outcomes of acute inflammation? The first outcome of acute inflammation is resolution, right? This is where inflammation stops and tissue repair itself and heals completely. Then secondly, we have fibrosis, which is scarring. Here, if damage is severe, scar tissues are formed. Then thirdly, we have abscess formation. Pus builds up if bacteria are not fully cleared. Then we have chronic inflammation. So if the cause isn't removed, inflammation continues, leading to long-term diseases like tuberculosis and rheumatoid arthritis. Most of the time, acute inflammation is helpful, but if it goes unchecked, it can cause more harm than good. So what are the treatment and management of acute inflammation? We have the use of non-steroidal anti-inflammatory drugs like ibuprofen, aspirin, to reduce pain and swelling. Then we have antihistamines, which block histamine in allergic reactions. Then we have corticosteroids, which suppress excessive inflammation. Then we also have antibiotics if the cause is bacterial infection. Then we have RICE ceremony, that stands for rest, application of ice, compression, and elevation. This is in case of physical injuries. In conclusion, acute inflammation is the body's built-in defense system, but when it goes overboard, it can cause harm. Understanding how it works helps us appreciate its importance in healing. Here are two clinical scenarios. Crack your brain and drop your answers in the comment section. Found this video helpful, don't forget to like, share, subscribe, and drop a comment below. Stay healthy and see you next time.